on average, I as a CEO pay $12,000 a year per employee today for health care. And that number has been going up 10 to 15% every year for as long as we can look back in the research of the book in the modern healthcare crisis as we'll define it. Think about that. In 1970, the average American consumed $400 a year in healthcare costs. Even adjusted for inflation, to go to $12,000 a year per employee for that CEO has put that CEO in a disadvantage in the global world that David talks about in The Shift Age and writes about in his book, The Shift Age, and then his new one coming out, Entering the Shift Age. $12,000 a year. So what's happening? I, Mr. CEO, am sitting down with you or your CEO of a healthcare hospital system and say, I've had it, I'm done. We need to look at this holistically. I'm willing to pay you $12,000 a year per employee for the first year. But in the second year, we're going to bring that cost down and we're going to do it together. We're going to bring it to $11,000. And I'm going to share the savings with you. I get to keep half and you get to keep half. But we're going to look at this holistically. And then in the third year, we're going to bring it down to $10,000 a year per employee. And in the fourth year, we're going to keep going. How many, or is anybody in the room from Seattle? Raise your hand, or the Northwest. You know that what I just shared has occurred in the city of Seattle. The Virginia Mason healthcare system model, is that where you work? Is one of the gold standards for what I just described that is taking the United States by storm. Anybody in the room from Dallas-Fort Worth? You need to meet this woman with Virginia Mason healthcare system. Because David and I have been working with new health age companies that are bringing the Seattle story to Dallas-Fort Worth. And it will transform how healthcare is delivered in that city.